Hi guys, it's your boy GF4Gent and welcome to my channel. If you are new on this channel, please do not forget to like, share and subscribe for more scholarly videos. Okay, now we're looking at something very interesting today. Okay, do you know that it's not all the time that you find glucose in urine that it indicates diabetes mellitus? Okay, and do you also know that it's not all the time, okay, that we find glucose in the urine of diabetic persons or patients? Okay, now let's look into that. Okay, now far from what we generally believe that when we find glucose in urine, it always indicates diabetes mellitus. That is not true. There are times and other conditions that can actually make you find glucose in the urine of a person, even when the plasma glucose level is normal. When the person is not diabetic, you could find glucose in the urine of that person, which we call glucosuria. Okay. Now, number one condition that can actually cause this is the Fanconi syndrome. Fanconi syndrome. Now, when we say Fanconi syndrome actually is the inability of the proximal convoluted tubule, okay, to reabsorb useful substances back into the blood. We know that the proximal convoluted tubule of the kidney is one part of the kidney that is responsible, okay, in reabsorbing useful substances back into the blood. When I say useful substances, glucose, electrolytes, bicarbonate, and other useful substances that are there. Okay. Now, the proximal convoluted tubule is responsible for reabsorbing these useful substances back into the blood. Now, when the proximal convoluted tubule become impaired, okay, become impaired or defective, its role of reabsorbing useful substances back into the blood will also be impaired, thereby leading to these useful substances finding their self or finding their way into urine, okay, even when their plasma level is normal. And that one of that useful substances includes glucose, okay. And in Fanconi syndrome, like I already said, not only glucose is affected, glucose, amino acid, bicarbonate, phosphate, most of the useful substances that ought to have been reabsorbed, okay, find their way into urine. Okay, so when you are doing, for example, you are doing urinalysis for such a patient, you will be seeing glucose in urine, even when their plasma glucose level is normal and within range. Okay, now another condition that can actually cause this is what we call renal glucosuria. There's actually a difference between glucosuria and renal glucosuria. Now, renal glucosuria, okay, is when there's an impairment or defect, okay, in the sodium glucose transporter 2, which is responsible, okay, for the reabsorption or transport of glucose back into the blood. Now, unlike the Fanconi syndrome, where the entire proximal convoluted tubule, okay, is defected or defective or impaired, okay, in renal glucosuria, glucose is the issue here. Other useful substances could be reabsorbed into the blood, but when the sodium glucose transporter, which is a transporter that is responsible for reabsorbing glucose back into the blood from the proximal convoluted tubule back into the blood, when this transporter is impaired, okay, glucose will not be reabsorbed and it will find itself or find its way into urine. So for someone who is having renal glucosuria, their glucose level may be okay, but you will be seeing glucose in their urine. You'll be finding glucosuria. Okay, let's talk about the possibility of someone being diabetic and we're not finding glucose in urine. Okay. Now, normally, for glucose to be in urine, okay, your plasma glucose level must cross the renal threshold of 180 milligram per dl. Okay. Now, when we say somebody is diabetic, some persons make the mistake of saying diabetes is when your glucose level is above 180 milligram per dl. That's not true. Okay. For us to say you are diabetic, one of the indications is when your fasting plasma glucose level, eh, is above 126 milligram per dl on 2 to 3 separate occasions. When your fasting blood sugar is already above 126 milligram per dl on 2 to 3 separate occasions, you are already diabetic. Okay. Now, in those cases, let's say, for example, a patient is having, let's say, 140 milligram per dl, 150 milligram per dl. Okay. The person is already diabetic, but because the plasma glucose level have not crossed the renal threshold for glucose, have not crossed 180 milligram per DA, you may not see glucose in urine yet, but the person is already diabetic. The person is already diabetic. Okay. Now, the only thing that may go contrary to this some of the times is in pregnancy, because in pregnancy there is increase in glomerular filtration rate, and also in pregnancy the renal threshold is actually reduced a little. So a pregnant woman could be having a plasma glucose of, let's say, 150 milligram per DL or 160 milligram per DL, and you're already seeing mild glucosuria. You're already seeing mild glucosuria. Okay, you're already seeing mild glucose in urine. Okay, so that's the only way that can occur. All right. Now, hope I've been able to educate you guys that it's not all the time you see glucose in urine that actually indicates diabetes mellitus. And hope I've been able to also educate you guys that somebody could be diabetic without finding glucose in urine. Okay? Now, thank you very much.